Hi, I'm Zevy Hamburger. I'm an anesthesiologist at Mount Sinai. I recovered from coronavirus about 4 or 5 weeks ago, and I've been working at Mount Sinai on the front lines, treating patients and trying to support our staff as we fight the pandemic. Right now, I'm on my way to donate plasma right before I go back into work to continue the fight. So I'm here in the New York Blood Center. I'm donating convalescent plasma. So what that means is that this machine is taking blood out of my arm, taking the plasma, which is the fluid component of the blood, out, and then replacing and giving me back my red blood cells and my platelets and other components of blood. So the way this works is by separating the components, they can harvest just the plasma component, you can see up here, which is hopefully rich in antibodies. This is something called passive immunity. So if we give this plasma to someone who's acutely infected with coronavirus, the antibodies that are in the plasma for me can hopefully start attacking the virus while the person themselves start mounting their own immune response, their own antibody response. So I'm just about done donating the plasma. The machine is just giving me back some fluid. It's really incredible to have this opportunity to donate. In our ICU, in our pop-up ICU, we actually were able to give units of convalescent plasma, of this antibody-rich plasma, to one of our patients. And whether it was that or something else, he didn't end up needing to get a breathing tube, didn't end up needing to go on a ventilator, and ended up going home. So I just finished donating plasma and now I'm heading back to work. I just wanted to give you a little bit of background about me. So I'm an obstetrical anesthesiologist, which means that 50% of my time I spend in the general operating rooms and 50% of my time I spend on labor and delivery, where I administer epidurals for pain relief for people having babies, and I take care of women who are having cesarean sections, and I end up co-managing with the obstetricians and the nurses pregnant women who are sick. When I came back after having coronavirus myself, my role ended up changing drastically. We're just walking into work now. So my own battle with coronavirus started on March 13th. It was right at the very, very beginning of the spread. I was really, I think, one of the first people in our hospital to get the virus, at least in my department, to get the virus. I likely caught it from the outside, from the community. It's the kind of thing where a week before you're thinking, hey, it's never going to happen to me. I know how to wear my mask, I know how to wear N95, I know how to don and doff the protective equipment. And in fact, I was one of the people who was showing other people how to do it. And then I started getting a cough on this Friday. I ended up going home, putting a mask on, and going home right away because the instructions were anyone get any cough, any symptoms, it's time to leave. I got fever that night. And my wife also started getting fevers, chills, some mild body aches. We got some GI symptoms. We got lost our sense of smell, sense of taste, and over the next couple of days, we realized after speaking to some of the infectious disease docs at Sinai that likely we had coronavirus. Ended up getting tested in New Jersey a couple of days later, and both turned positive. Our kids, we were obviously worried about. It's almost impossible to quarantine away from 2 6-year-old girls and a 3-year-old boy who all they want to do is play with you in your home. And so we were worried about them getting ill. But luckily, they probably got very mild forms of it, just maybe some GI upset, very mild fever, irritability, which lasted only a short period of time. An important question probably a lot of people have is why anesthesiologists? What's our role in all of this? A lot of elective surgery has been canceled in America, so why are the doctors who put people to sleep playing an active role in this response? And it's largely to do with our training. Even though our job is to keep people asleep during surgery, really what we're there for is not to keep you asleep, but to keep you alive during surgery. We take care of some of the sickest people in the world while they're having an incredible stress, which is surgery. And really what we do is resuscitate. We keep people alive. We bring people from the brink back to life. And that's where our skill set lies. So when we have a pandemic like this, in which people require ventilatory support, they need to be on ventilators, which is part of our expertise, or their blood pressure is dropping because their bodies are responding to this infection in a dangerous way, That's really our bread and butter. So I'm headed right now to assist with an intubation. That means putting a breathing tube in someone who's getting sicker and sicker and having difficulty breathing on their own. This is the procedure that is one of the scarier procedures in the coronavirus era, because this is when the virus can be aerosolized. I'm here with the rapid response team. Who's behind me? Here's Charlie, one of our nurse anesthetists, who's going to come in and help intubate with me. It's obviously a team effort to take care of these people. And our goal is to really prepare everything outside of the room so we can minimize going in and out so we don't contaminate the area outside. Even though we're on a complete COVID unit, many of the staff members have not luckily been exposed and have gotten sick. And so right now we're preparing so we can take care of this person safely and compassionately while still protecting the rest of our staff. So we're all ready to go. Jay, our respiratory therapist, is actually bringing in one of our ventilators so we can get prepared and everything set up before we actually do the procedure. So, sir, we bring in all of our equipment. Here's Charlie again with all of our equipment together, ready to go. So again, we can minimize the amount of time we actually have to open and close this door. We're running to another emergency airway with the rest of the rapid response team. Obviously, trying to assess the situation as quickly as possible and intervene while we can to help people. It seems pretty busy today, but the whole point of the rapid response team is to support all the other physicians in the hospital who are taking care of patients and make sure that we can get the proper people to help when help is needed. So it's a dynamic staffing model, which really, really improves outcomes. And I've seen it just by joining them for a couple of weeks, the incredible work that they do every single day. So this is one of our ICU teams. It's run by Koichi, one of our anesthesiologists. Say hello, everyone. Working hard, taking care of the COVID patients. So Matt and I are on our way now to an ICU to help back up some of our ENTs manage a very difficult airway situation. So it's a whole team here trying to help and figure out what's going on. Hey, I'm here in one of our ICUs. I'm joined with Shinobu, one of our cardiothoracic surgeons. We're actually working together to manage a difficult airway situation. That means when there's difficulty putting breathing tubes in, or tracheostomies, which are breathing tubes in the neck instead of through the mouth, working together as a team to try and get the best outcome for our patients. Obviously, all critical care is a team sport, but especially now more than ever, is a lot of communication that's needed and really planning for all of our patients. So I'm running to another intubation. This is my fifth of the day, actually. It's just about 2:30 in the afternoon. I joined the rapid response team originally because I was hoping, since I had the virus myself, I'd have some modicum of immunity. And since intubation is a higher risk procedure and it's something that as anesthesiologists is really part of our specialty, I was hoping that if I could kind of get in the way, we can prevent some transmission to some of the other staff members and colleagues. I've been intubating patients working on units for about 4 weeks now, and luckily I have not got reinfected. I have no new symptoms. I've swabbed negative. So again, just hopeful that there's some sort of immunity that we can develop to protect our staff, but also so we can take good care of patients without this fear. So one of the biggest take-home points I've learned from this pandemic, from this crisis, is our team is made up of nurses, of respiratory therapists, of ICU doctors, emergency room doctors, anesthesiologists, nurse anesthetists, everyone. Even though we all come from different areas and probably would never have crossed each other besides for this pandemic, we're all on one team. We're all on Team Sinai. We're all on Team Humankind against this fight. And when we're done with this crisis, when we've won, it's going to be really incredible to work in a place like this where we're all going to know each other, we're all going to remain friends, and we're all going to work together. And the only people who are going to benefit from that are our future patients. So I have a lot of hope. I think that this is going to make us come out a lot stronger, and I really look forward to what the future brings. So I'm leaving the hospital after a long day of intubations, helping out with the rapid response team. When I'm leaving, I kind of feel very lucky. I'm someone who had it and recovered from it, so I can go home and see my family and spend time with my family, because we all likely had it and never have some semblance of normalcy. Many of my colleagues, most of my colleagues who didn't yet get infected, they're still here on the front lines doing the same thing I am. they fear bringing this home to their family every night, making them sleep in different rooms or live away from their families, not eat dinner with their family, not really even interact with their kids, with the fear that they could infect others. So I definitely count myself as one of the lucky ones that I've had it already and recovered. But this is really the stress that healthcare workers have right now. It's not just getting themselves sick, but spreading it. Just coming back to the ICU, one of the COVID units, to check on one of the patients that I took care of, helped them put the breathing tube in with the rapid response team. He's actually sharing a room with one of the patients who was in our pop-up ICU that we ended up luckily shutting down as the other ICUs came online. It's really kind of crazy how sick this virus makes people, and it's because there's no visitors here, we end up taking the role of not just people as doctors, but also the representatives speaking to their families, trying to connect loved ones with each other. My first day in our pop-up ICU, I had to have a conversation with the patient and her son about what she wanted done for her, what kind of extreme measures we can do to keep her alive. And I had to be part of the conversation and help lead the conversation. And towards the end, one of the important things that we had to do was make sure that they could actually say goodbye to each other, because this disease is so dangerous, and if you have other comorbidities, the odds of coming back from it when you're already so sick is not so high. So I'm holding the phone, trying to speak between mother and son and other family members, what might be their last words to each other, that they can remember, trying to help them through this horrible moment, besides for taking care of her medically, but also trying to help them see each other as best they can through a phone and feel each other through a phone. And it's those experiences are what's gonna probably haunt many of us for weeks, months, years to come. It's an awesome responsibility. It's incredible, and we take that role very seriously. We are people treating people, and the emotional component to it can never be separated from the medical component to it. And especially now that we're the only ones here for people, their families can't even be here, it's even more of our responsibility to be the people taking care of each other, instead of just the doctors or the nurses or the techs or anyone else taking care of each other.